I am joined this evening by the phenomenal Dr. Stevens, an epidemiologist who we're calling on CNN to take this moment to think about the creativity in African American health professionals as they continue to have pundits that don't represent our community. At the same time, it is our pleasure to bring in Dr. Ridden, a dentist who is from New York, so she clearly is in the eye of the storm. I make light with CNN, obviously, but I am going to ask the question on seeing African American healthcare professionals in and on the media, and why there's such a huge absence given we have individuals qualified. So, but before we start, it's going up. It's going up. If you didn't believe it, it's going up. It is going up. Now, I'm confused, but maybe we need to go through it ABC, play it like everybody's back in elementary school, Dr. Stevens. But please help us understand, and I'm going to ask the same of you, Dr. Ridden. How do we stay safe? How do we keep these guards up? Because obviously we're willing to let them down right about now. Dr. Stevens?
Yes, I have every week my sentence the same. Definitely, if you are outside of your home, you need to be wearing a mask. You need to be washing your hands frequently. If you can't wash your hands, you need to be using hand sanitizer for 20 seconds still, and definitely social distancing. And I know we're still saying 6 feet is the general rule, but as I've previously stated on some other panels, studies have shown that the virus, like one single particle of the virus can reach up to 30 feet. So, but one viral particle really isn't like contagious, but just think about that. If one particle can reach up to 30 feet and you're still in a group of people. So keep that in mind when you're outside. If you can do more than 6 feet, then by all means, but we have to maintain these principles that have been put in place to just safeguard ourselves. And I think we so many people have gotten relaxed because stores are opening and states are opening in general. And this is not the time to let our guard down. We're still in phase 1. And so many people are like, oh, we're in the summer, it's going to die down. Well, we are in summer, it is ramping up. And so you definitely have to practice these safety measures at all times and not just when you think about it.
Right. Yeah, I agree. The rules didn't change. The virus didn't change. Nothing changed as it relates to how this virus works. We, as a society, we're starting to change because things are opening up. My dental office, we're only in our 3rd week of reopening. The 1st week of reopening with certain staff, we're doing a phased reopening. But the reality is, if we don't keep our heightened awareness up about how we need to behave when we're outside of our homes, then it's going to be a problem. Right. So the rules didn't change. Keep washing the hands, keep wearing the mask, keep staying away, and stay inside as much as possible.
Well, I don't know that Dr. Stevens hasn't said it 2 million times, but I would like to point out the question I want to know is about letting your guard down, because I think the excuses that I hear for people in our community, I'm going to visit a friend.
Yes. And that's something that I know I say daily. And you still have to maintain your safety within your home. And so if you want to go out with those that you have sheltered in place with, because once you break that circle, and I always give the example of being inside, everyone inside your home is a circle. So your circle is intact, but anytime you allow someone from a different circle to come inside, so you've kind of broken that chain. So visiting a friend who has quote unquote been quarantining or has been sheltering in place or not around a lot of people is still not safe, because you don't know the people they've been around who's also said that they haven't been anywhere and they've been sheltering in place. And so now that's what we're seeing more so in the younger people. And so the numbers for the past 2 weeks, months, and have actually been in the younger, the 20 somethings and 30 somethings, because they're the ones at the beaches, they're the ones having the barbecues at the park and picnics and what have you. So unfortunately, their infection rates have increased.
You know, I hear I'm going to visit a friend. That seems traditional. And then the other thing is we're having a small barbecue. Like a friend invited me over to a small barbecue. He said, well, I just got a couple friends over. I said, well, that's cool. Why don't you FaceTime me once it starts?
Yeah.
To my chagrin, what was supposed to be 4, I was going to be 5. They had 15 people.
Yeah.
Our psychological impact of going to visit friends seems very dangerous.
Yeah, it has become dangerous. And we've kind of let our guards down when it comes to still social distancing. And just because it's a small group doesn't mean that you're not at risk. I've seen so many pictures and videos of people gathering with no mask on. They're not social distancing. They're at a park, so I'm pretty sure the hand washing is kind of non-existent at that point, and hand sanitizer is definitely kind of scarce right now. So I guess my question is, how, like at that moment, how are you adhering to those policies? It's mind-boggling to me, because the virus did not change. Even with everything that we are experiencing right now with Black Lives Matter and the protest and marching, the virus didn't take a break and say, hey, I'm gonna just, chill while you guys do what you do. And I have been on panels and spoken, about just how to safeguard yourself during a protest. So we haven't given ourselves a break. We haven't given the virus a chance to actually take some time for it to go down. When you have early reopenings in Georgia, then you have Memorial Day, then we had protests, and now we have everybody flocking to Florida. And then you're going to have 4th of July. So at what point will we give ourselves a break, or will we be in a position where we're not putting ourselves at risk because we haven't given ourselves or even just given the virus a chance to just die down? And that's the issue right now.
Dr. Reed,
Florida.
that's your take?
Yeah, so while I totally agree that the virus, nothing has changed as it relates to how it moves. But as a society, it's true though, we do have to begin to get back in, right? People are coming back to the dentist in New York City as of 2 weeks ago, right? So my only thought is, how do we get back in and do it responsibly so that we can continue to keep those numbers down, right? So the barbershops or the restaurants, whatever the establishment is that we have to try to get back into, because people need their teeth done, people need their services, people need to socialize. You had made the point of going to that cookout. We had a little Father's Day thing, but we did it responsibly. We followed the rules, and we kept, it was only 5 of us in the house. But the point is, how do we get back in, but responsibly and safely? You know, in my office, I've created a whole new set of rules, policies, not only for my staff, for ourselves, for our patients. And we're strict about it. You know, if you're not doing what we need you to do to keep us all safe, then you can't come in, you know, whether it's a staff member or if it's a patient. So, you know, the guidelines, the rules, how we should be moving during this time is something that I really think we need to emphasize as a society, as a community. You know, whether it's at your home or whether it's at your dental office or whether it's in the park, you know, these guidelines need to be adhered to so we could do it safely.
Dr. Reardon, I agree, because those are some of the questions that I've received. Like, is it okay for me to go get my teeth cleaned? And I tell them, yes. I have a wonderful dentist. She's an African American woman that I love, and talk to her. I will have been talking to her with her practice, and she did shut down. She took some time to just kind of regroup so that it is safe. And so in the Black community, that's one of the things that I express. You can't stop getting your basic visits done, especially teeth. And some people argue with me saying that, you know, getting your teeth clean wasn't a priority. And I say it is, because a lot of people have been home. They're eating more than usual. And if you're not a flosser or anything like that, you know, you need to have your teeth clean, because you can have periodontal disease or, you know, any type of gum disease. So I don't ever say, no, don't go. But what I do advise them to do is talk to their dentist office or their dentist and say, what are the safeguards that you have put into place? My dentist has like everything state of the art as far as like controlling the virus. She closed her waiting room.
Yes.
And when we get there, she's like, come get your teeth cleaned. And so I guess I was like maybe the guinea pig, and I was just like, I don't know. But, you know, just to go through her practice, her procedure, and it worked well. No one can come in. You call them when you get there. Someone come to the door and let you in, so that no one's on top of each other. You're not bombarded. And that's the one thing that I have been just really expressing to the community. Don't stop going. If you can go to the grocery store and be out there and expose yourself, then you can go to the dentist who is actually taking, you know, the proper procedures. But they should have, I was like, your dentist, if they're open, should have sent you something saying these are, you know, the new procedures that we have in place.
So I've got Representative Dr. Jasmine Clark. How are you?
I'm doing well, and I really do apologize for being late. We just got out of a committee meeting, like literally just now. It's been a long.
You got some miracles happening for all the Black women in the state of Georgia. So we're happy to have some healthcare announcements about what is 2 M's?
House Bill 1114, 1114. It is a maternal mortality bill that basically expands Medicaid for pregnant women to 6 months postpartum instead of just 2 months postpartum. It's a good bill. We really wanted to get it a year, but the compromise was 6 months. And I'm really happy that it actually passed both chambers and is headed to the governor's desk. The only major hurdle is getting it funded in the budget.
Well, thank you so much for joining us here at Healthcare IQ. Dr. Reardon, you're about to say something.
I forgot.
I apologize. I'm sorry.
The importance of getting your dental care and not foregoing your basic procedures.
It's true. Yeah.
The whole idea of protocol, Dr. Stevens, that you talked about, people have to know to demand that. And that's one of the reasons why we're having this conversation. It's important that you are able to communicate with your healthcare provider and let them know. Go ahead, Dr. Reed.
Yeah, that's exactly what I was going to say. I can't tell you how many conversations we've sent out a very detailed letter, but I don't mind one bit that patient calling up asking, well, what are you doing, doctor? I'll repeat it a million times because I need to reassure them. When we were planning to reopen, that letter was so important to me because I knew it had to not only give information, but also give a sense of, ooh, okay, I can do, like, trust, build that trust back, and build the confidence in them that they know that, okay, I'm going to be okay. She's going to take care of us, we're all on the same page here. And I've also had calls from other non-patients in the community who are like, wait, are the dentists that I go to, he's doing this, so there are people that are doing it right. Restaurants, dentists, hair salons, people are doing it right, but a lot of people aren't. And if you are, seeking the service of anyone, you should know and be confident that they are going to keep you safe. And I think that's a big part of stepping back into our old habits.
When you think of it, and I'm asking you, Representative, what are the kind of 90 days of health changes that you see that you hope everyone has made? I've noticed everybody is willing to change their behavior. Let's watch a quick video before you answer that question. Ashley, that means that Portia's supposed to play the video. Days being in the house. What health adjustments appear to be in this scene?
Okay, so I think that we should address what should have happened, and we can also address that there are certain people who are doing it right, kind of similar to what Dr. And I'm sorry, how to pronounce your name, Reardon?
Reardon, yeah.
Reardon. What Dr. Reardon and Dr. Stevens said, there are people following the rules, following the protocols, listening. There are people that are wearing their masks and social distancing and doing, not, going out in big groups and things like that. And then there are people who aren't following the rules. And there is no real enforcement of the rules. We have to self-police. And so when you are in a situation of self-policing, you're going to have some people that do it very well, and you're going to have some people that do it very poorly. One thing that I will say, though, is that as far as what people should be doing, you should still be staying home as much as possible. You should be wearing a mask when you're out in public. That mask not only helps you, it actually helps the people around you. You should be asking the questions of the places that you patronize. For example, when I took my dad out for Father's Day, I went to a restaurant, and before I went, I called them and I said, are your waiters and waitresses wearing masks? How are you doing ordering? How are the tables spaced out? What is your protocol for addressing the coronavirus pandemic? Because the issue is someone's got to do something. Like, they can't just pretend like this is not happening. The numbers are going up. We're 90 days into this thing and it's not getting better. The numbers are increasing. I just read a news article before this meeting that in Milledgeville, they're having to open some makeshift hospitals because they're running out of beds. We are still very much in the thick of this pandemic. The problem is this pandemic is very inconvenient. It's the summertime, it's beach season, pool season, sundress season, flip-flop season. People were ready to get out, mix and mingle and do all the things we do in the summer. And then this pandemic came at the most inopportune time, and after so long, people get bored with it and they just need an outlet. And again, when you're in a situation where we're self-policing, some people are just not going to do it. So the best we can do is just to continue to encourage people to make good decisions. And I think that when we look at leadership, I think our leadership needs to set good examples. If they're not wearing masks, then people don't think masks are important. If the leadership is saying everything's fine, open everything up, everyone go to Six Flags, then everyone's going to go to Six Flags. You know, it's like a lot of times people aren't going to look up everything. They're not going to follow the Department of Public Health website. They're just waiting for somebody to tell them what to do. And so that's where you know, leadership comes into play. Community leaders, our governor, all the way down to the most local community member, needs to be getting the message out that yes, I understand you want to get out, but you have to do it safely.
I agree. And I post numbers daily on my Instagram page, and just with the amount of confirmed cases that we're seeing in Georgia, just over, and especially just over the weekend, where Georgia added 3,922 cases from Friday to Monday. And so then that was like the spark. And so I got the question, so what about beds? Where are we in Metro Atlanta? And so I grabbed the data. And so as of yesterday, the entire state only had 59% of their ER beds available for the state of Georgia. In Metro Atlanta, as of yesterday, there were only 480 ER beds for all of the counties. That's Metro Atlanta. And critical care beds, only 371 were remaining as of yesterday. I haven't yet pulled the numbers together for Georgia today and just for Atlanta. And the crazy thing is general inpatient beds for Metro Atlanta only has 28% availability. So that's 1,285 beds. And we're adding anywhere from like 600 to 1,000 new cases daily, just in Georgia.
So I guess the question was adjustment. And I hear what everyone has said. But I'm not feeling any adjustment, Dr. Stevens. I hear everybody. And as a media person, I want events, car sales, but I think it's in a realignment. I think it's a denial. The issue that we're really having is we have elected not to make a mental health, and I think Dr. Stevens and Dr. Reardon, and I'll ask it, you know, comorbidity is an issue. Now we're going to be in denial about the fact that you could make some eating adjustments right about now with a bit of habit in 90 days. We've all elected not to have habits and ignore a glaring. We're gonna still be blaming a system that at this point we're gonna have to take responsibility for Black health. I mean, I don't think we can act. So I'm not certain there's a mental health adjustment that has happened. Dr. Reardon, do you see a mental health adjustment as it relates to our own health care?
Well, you know, as I'm hearing the statistics in Georgia, forgive me, but I don't keep up with, you know, your numbers, but we in New York, New Jersey area, we're having a different conversation. We talked about beds, numbers going up, daily count 2 months ago. We were talking about, you know, everything that you're experiencing. I do believe we had the leadership that shut it down.
Right.
You know, our systems that had never been, the subway shut down. We New Yorkers, I do believe we did a really good job of containing it and being responsible and checking ourselves and saying, let's stop so that this, you know, so that this whole, you know, the virus stops. it scares me that it didn't happen everywhere. And that was like the effort that we needed as globally, or at least nationally. It didn't stop everywhere. And now we're having these hot spots in other parts of the country. Now, as far as our mental health, I worry about that too, because this pandemic has really taken a toll on us emotionally, physically, spiritually, and I don't know how we're going to recover. You're right. We all are suffering in different ways with, domestic violence and, all the things that were festering before have just kind of exploded within our community.
You can say that again.
Yeah.
Every day it seems like we're closer, Dr. Stevens.
Closer to what, breakdown?
I mean, all I can see is a breakdown, because it's I think even transportation doesn't want to accept the level of responsibility that they are playing in moving people around. I mean, I respect New Yorkers and what they have to say, but y'all exported a lot of your people as they left New York looking for a safe haven in other locations. And
I have family
I don't want to ignore the truth, but it's like, I got a house in Florida, or we gonna go to the beach.
Yeah.
And you're a young person and you in New York and you got little money, or, the couples and families. So I think, just the tragedy made people move. I mean, I think that's pretty documented. And if you were pretty well to do, you pretty much went to the post office, shipped your mail, your checks, and, got out of New York City. But I think the other thing about New Yorkers they're always on the beat. Like, what's the beat? Because we don't want to be part of the bad beat. So everybody is able to get in the beat. And I think for the people that I talked to in New York, they got it. Not only was the leadership in line, the culture is, you know what? We got to survive, y'all. We got to survive. When you're in a city and that's the motion, then everybody's like, what are you doing, son? But there were places in Brooklyn, and I have friends there, they say we got to move our kids because I don't want to walk down the street and there are people that don't have a mask on. Still, you have real issues. And I love the, Dr. Stevens, we got to steal this one, the self-police.
Yeah.
Because Lord, we know self-policing an invisible enemy, is a tough road right now.
Yes.
I mean, it requires acknowledging that it even is happening. A good example of that is the fact that I am required to wear a mask here at the Capitol. On the Senate side, they are not required to wear masks. They are encouraged to, but they are not required to. If you were to walk into the Capitol, the state Capitol right now, there is not a single solitary Capitol police officer with a mask on, and they're all over. Not one of them is wearing a mask. It is like they are making a statement that we refuse to acknowledge that this virus, and let me tell you, this is on top of the fact that we actually had confirmed cases in this building, and we had confirmed contacts with positive cases. And the message, again, it's when you see the people who are supposed to be doing right, how are you protecting and serving if you won't do the simplest thing and not possibly exposing me to coronavirus? And so it mentally, I have a hard time understanding why certain people have just decided, if I pretend like the virus doesn't exist, then I don't have to do anything pertaining to policing myself on this virus. So I'm just going to go the route of, there's no virus, everyone else is silly, I'm fine. Or go the route of, everyone else is wearing a mask, so I don't have to wear a mask. I don't know.
Well, I think we do know. You think we know, Dr. Reed?
Well, so there's a lot of messages in our community that are telling us just that the virus doesn't exist. It's it's not that serious. The numbers are going down, when we know it's all a lie. Mixed messages.
Yeah.
And then too, here in Georgia, whether or not you wear a virus kind of I'm sorry, whether or not you wear a mask or believe that the virus is real has become a political statement.
Yeah.
So, which is crazy. And we were talking earlier about how America is in a state of rebellion. And when you have a president that doesn't wear a mask or practice social distancing, that's the message that's going forth. Because even if you have a group that don't support the president, but when they see him walking around freely around other people, so that mindset is, well, maybe it's not true. If the president of the United States isn't being cautious, then why should we? So then that's when the conspiracy theories tend to come forth, because it's like, well, they're saying it's here, but the people in Washington aren't wearing masks, or the people in the state capitol aren't wearing masks. I drove past, the Capitol, and the state police were unmasked. So don't come into my neighborhood and tell me that I need to wear a mask or practice social distancing when the powers that quote unquote be that make these decisions on whether or not we're safe aren't.
Exactly.
Dr. Clark, you had mentioned that this virus came at an inconvenient time relating it to the seasons, but I feel like it was inconveniently arriving because our country has been so divided politically. We're such a partisan country since, the last couple of years. And this virus is just consistent with what the tone is with everything as it relates to how our country responds to different things, So I agree, politicized for sure.
Yeah, definitely. I mean, I ran for office as a scientist because I felt like science was under attack. And then we have a whole pandemic. And if any time, normally, historically, in times, think about 9/11 and other major events, those are normally times where people put aside the partisanship to try to come together. We are Americans. That didn't happen this time. This time, it further divided us. It really, to the point of, mass becoming a democratic thing. Big D democratic thing. Democrats wear masks. Republicans are strong and they don't need those masks. Safety precautions, restaurant owners, again, being cavalier in the name of we're good, strong Americans and we're patriots and we're not going to make our waiters wear masks, versus other restaurants being like, well, actually, I would rather not expose not just my staff, but anyone who comes into my restaurant, because if the word gets out that I infected a bunch of people who came to eat here, that's going to harm my business even more. We talk about the economy in this matter, but pandemics, no matter what, are bad for the economy. Like, there's no way around that. And so I understand having to get back out there and get back out in public, but I do think that is disingenuous and just bad politics in general to somehow pit the economy to life and sickness and science. Like, there's got to be some middle ground there.
And that's exactly what happened in Florida. Florida's numbers are through the roof. And the governor said, well, we can't afford to shut down. We're going to, keep going full steam ahead, opening schools. And it's just kind of falling on the mayors of the individual cities. And I know in Fort Lauderdale, and I think the Miami-Dade police, they're enforcing masks and social distancing only because it's a hot spot right now. Yeah. And there are some restaurant owners in Florida that are trying to figure out how to report restaurants that aren't, practicing the rules, because it makes them all look bad. But at the end of the day, like I said, when you put an economy before a person, dead people can't buy things. So, I mean, think about that. When you think about who your mass consumers are, and they're the most affected, as in Black and brown communities, they can't buy things if they're not alive to buy things.
not only do dead people not buy things, but we have lots of data that shows that scared people don't buy things.
Well, that's
Consumer confidence is the driver of our economy. And if consumers are not confident that this is being taken seriously, if they're not confident that they can't go into a restaurant and not come out infected with coronavirus and possibly have to end up on a ventilator, then they're just not going to go. And
Right.
so you can't just reopen in the middle of a pandemic and expect everyone to start flocking to, places and start spending their money, because that's not how the economy works. And I think that that's what I'm saying when I'm saying they're leaving out the major, you need living people. You need relatively healthy people that can actually go somewhere. And you need people who are confident enough to actually patronize your establishment because you're taking the proper precautions. You need all of that, or you need a bunch of ignorant people who are, and ignorant, and when I use the word ignorant, I mean ignorant in not knowing. People who don't know what's going on. And so they're just walking around blissfully without knowing what's going on. No one should be doing that. But I think some people have decided that the best place to be right now is with my head in the sand, because that's safer, or that's mentally safer for me than having to acknowledge that there's a threat among us.
Well, I like that, but part of my theory is also the pundits. That's why I asked, having Black scientists speak to our community was so key. I mean, you can just imagine how some of the brothers, Dr. what? Dr. who? I don't know if I'm gonna believe him. He looks like a nice guy, but that ain't my cousin. That's not my brother. I don't have access. And I'm not sure why we're quiet right now when we literally need to be saying out loud, you gotta include us.
Yeah.
Any reason why that's not happening and they don't see that that's an issue? Because we don't trust everybody. And if it's not somebody I trust, and we know we have scientists, but you're keeping them away from them conveying their messages, why is this happening? Any idea, Dr. Stevens?
I know you're going to ask me. I don't think they want to get the message to those that's affected the most. I mean, it's no secret how the Black community moves and how they respond to events, to messaging. So if you have the mass media message that we're not going to put someone in front of you to get this message to you, then that speaks louder. Because when a politician wants to be considered, or a politician not of color wants to be considered in their district, they go to the church, right? Because they know that's how they get recognized, and that's where the buy-in comes. But when you think about mass media and the messaging that they're putting out, they don't care. They don't even have real public health practitioners or even real doctors sharing this information. So would you believe someone giving you information about a pandemic and something as serious as COVID-19, and that's the same person that was just reporting on the horse race? I mean, come on. For something like this, people want to hear from someone that has experience, someone that's working.
But you don't have any experience. You've never been there. I mean, Don Lemon has more experience than you, doesn't he?
No.
Don, we're calling on you, bro. Invite Dr. Stevens, Howard grad.
Yeah, I mean,
Don.
I've worked.
Don, please help your people.
They don't want our help.
We need Black dentists on the show, Don.
They don't want our help. I mean, at the end of the day, that's essentially how it is. If whatever message that you want to get to a particular people, that's the person that you put in front of them. When you're trying to get a message across to children, you use children. So that's the same thing when you look at communities. If you really and truly, genuinely want to get a message to a group of like people, you use a person that's representative of that group, and that's not happening. So what that tells me is that they don't want to. It's not important. And so I don't watch these. I've stopped watching. I have my own experience. I've worked the MERS outbreak. I've done Ebola. I worked with Ebola before it was even a household name, and I published papers on it. I've worked with almost every category A agent that could be used as a biological weapon in the world. I worked under the Obama administration where we had a global health security initiative. I worked on that pilot project. But no, and I'm not being tapped for anything, but I'm out in my community and I'm doing what I can because I know what works. I know when you go to a village in Africa, you can't just talk to someone. You have to have someone representative of that village in order to get the people to comply what you're trying to get them to do. And that's the same thing that should be happening here in Black communities, and that's not happening at the end of the day.
Can I say that I agree with everything Dr. Stevens said. I agree with what you're saying. I agree with what the premise of what you're saying, but as you were talking, I thought about it and it just started rolling through my head. Like, who are the Black people who end up getting the platform, that end up being the pundit, who ends up being on TV? We got Diamond and Silk. We got Candace Owens. We got the Surgeon General dude. I mean, he's kind of like in the middle area. They putting us on there, but they're not putting us on there.
No.
They're putting the people that will advance a certain narrative and also perpetuate certain stereotypes about Black people. So for the Black audience, they're like, look, we gave y'all a Black person. And for other audience, they're like, yeah, this is exactly what you think about Black people. Yeah, this is what you get. And so I just want to be clear. I think your point is very important. Yes, we need more Black scientists, Black epidemiologists, Black dentists, Black doctors getting on these shows and talking to our people about what's going on. This outlet that you're giving us today, this is very important. We need this more at lower levels and at higher levels. But let's not kid ourselves and act like they don't have a list of what I will say are acceptable Black people that get to be the spokesperson for Black people. And we're just not on that list.
Yeah,
Go ahead.
On a national stage, it's true. You know, we're not going to see that represented because they don't want to represent that. I am encouraged, though, on a local level, that our community, we are out there, and in the New York City commercials, we are seeing ourselves reflected in people telling us how we should be behaving. So you're right. The messaging has to come from and one of the greatest things that I'm so grateful for is where I practice in the heart of Harlem, and all my patients, we have this connection because they know that they can trust because of who's the deliverer of the message, So I agree, it's very important. And if we're not going to get it on the national stage, then maybe we can work on a local level to push that messaging.
Well, I just wanted to ask the question because I think, it's one thing to talk about local, but when we have so many individuals and they say they're watching TV, they're on cable.
Yeah.
If they're on cable, they're on a national, and I think we've got to ask more. I think it's one of those things, while there's an uprising, we really have to say, well, we told you.
Yeah.
I don't think it's during an uprising, Doc, that we say, you know, we're going to wait for you to let us call on us. I think we really have to say what racism looks like, even on the platforms. Even when they say they have enough of us and we say, no, you don't. Or maybe you should rotate the one you got because we ain't seen them at our barbecue lately. So, we've really got to make sure that we are doing enough at this moment or they'll say, well, we didn't know, because that's the go-to. We didn't know that was on your minds. And we've been doing this, and Dr. Stevens, who I'm so proud of, and she is, not only does she stand up, but she educates. Obviously, when it came to calling, I know that we can call you. I think, our professionals, dentists are important. So we wanted that. Dr. Stevens had already told me about her, but Helen, we're working to get the faces that match. All of y'all could be on TV today. Y'all got to I'd rather look at y'all than Don. No shade, Don, but it's cool, man. I mean, no big deal. I just would prefer the group that I have. I just want to say to all of us as we move forward, what are the insights that you're taking away from this that you're applying to your own personal life? What are the insights that you're gleaming in this pandemic as it relates to what you do and how you're changing what you do in your life? Because I'm not certain everybody gets an insight from insightful scientists, insightful dentists. Obviously, they don't hear it from enough epidemiologists. Dr. Clark?
So that's a very good question. So I have a lot. I keep my mask on. I rarely leave my house without a mask. I also carry hand sanitizer with me, and I am just very aware now. Whereas before, I feel like I kind of walk through life kind of just haphazardly, not really necessarily thinking about every single thing that I touch and come in contact with. Now, it is on the front of my brain. When I touch a doorknob, I immediately feel like I need to wash my hands. When I touch a pen pad at a grocery store, I immediately feel like I need to wash my hands. I'm very aware of people's closeness to me now. I'm actually very aware of other people's closeness to each other. So I cringe a little bit when I see someone shake hands or hug or high five. I'm like, I don't feel like we should be doing that. As it relates to how I move in society, I am actually smack dab in the middle of a campaign. I'm on the ballot in November. So I got to figure out how to reach my voters, talk to my voters, but at the same time, do it safely, maintain social distancing. How do I work with my volunteers? Do I meet my volunteers in one room? Do we meet at a park where we can all stay spread out? Do we just do a Zoom meeting? And what am I going to have my volunteers doing? Because if you're volunteering for my campaign, I feel responsible for your health. In a public health situation like what we're in a community spread situation, we can't just think about ourselves. I'm very aware of everything that I do, how it'll affect my children, how it'll affect anyone I come in contact with, how it'll affect my neighbor, all of these things. So I think the way I move now is just, I am hyper aware of things that I may not have been, not have been thinking about more. And I'm also hyper aware of my place in a community and my interactions with others, where, I don't want to potentially spread the virus to someone else. And I'm also very aware of other people and how they could be potentially spreading the virus to me. So that is how I move. Earlier, we talked about calling people and asking protocols. Literally, if I'm going to a place, the first question is, do you have a patio? And the second question is, are you wearing masks? I want to know that before I even crank my car up to go and patronize a place. If someone wants to visit me, I kind of want to know, who have you been around? Do you wear masks when you go out? All of those things are important to me. And I think if everyone thinks that way and moves that way, it will make it a lot harder for the virus to spread.
Dr. Reed?
Yeah, that heightened awareness is definitely something I'm experiencing as well. Just your senses are up about everything around you. But with that awareness, I've also begun to prioritize differently. So, personally, I prioritize, do I really need to get this or go here or buy this, because finances have certainly changed as well, So prioritizing the things that are important, not only at home, but now in the practice, I'm prioritizing my patients' treatment plans differently. We talked about needing cleanings, but if you let a small cavity just grow, then that becomes a root canal, So how do I prioritize treatment plans that will allow for my patients to get the most in one visit, so that reduces their exposure? They don't have to come back to the office as many times. So when you come for that cleaning, I'm probably going to knock out a couple fillings and whatever I can in that moment to once again make the best use of our time, So yeah, prioritizing differently and just being aware of every touch.
That sounds real good. I'm very pleased that you guys have done that. How about you, Dr. Stevens? You got tons of insights on what's changed, but this is kind of your lane.
Yes, as an infectious disease epidemiologist, I was doing all of this before. Honestly, I have not been inside of a store since March 16th. I don't plan to go inside any stores or restaurants, protocol or no protocol, because those are uncontrolled environments from my epidemiological point of view. I have gone to the dentist, like I said, for a cleaning to kind of walk through her protocol, because I was kind of consulting with her on the things that she needed for her office, and the different things that she could do to minimize exposure for her patients. So I did do that. I'm not going to gatherings inside, basically, or outside. I do Instacarts. I do pickups at Target. That's just how I roll, but that's just me. And I always tell people I'm an epi. I've been practicing this for most of my career. Even before then, I've just always been that person. But I do, when I am out or on the way or see someone, I take extra mask with me. I have face shields while I'm out, and I hand out masks. Like, here you are. I'm the one that's calling people saying, hey, do you need masks? Do I need to drop some by? Just to make sure, because we also kind of take into, we take for granted that people can afford masks.
Right.
And that's the other thing. So that's another issue, just talking to some people, especially in the neighborhoods that are hotspots like Campbellton Road. I had a conversation with some churches there, and they're like, we're in the middle of a hotspot. So how in Metro Atlanta, so how do we help? So things like, I have a vendor for PPEs that I use for my business. And so I'm like, hey, I need to order some stuff. I need to get some cleaning supplies for this church so that they could pass it out to community members. So that's kind of what I'm doing. I'm more, I'm very private, and I don't really hang around a lot of people. Even before the pandemic, my friends will laugh and they'll tell you, but ironically, this has made me more so community involved, in making sure that the communities, not necessarily that the ones I'm involved in, but the one that I live in, because my community doesn't need it, but I make sure that I'm going to those communities that are particularly hotspots, and just kind of doing needs assessments and seeing what's there, what they need, and just trying to connect them with the right resources.
Well, I saw you guys at this party. They got a great party that they invited everybody out to, and it was good to see you guys there.
I know a few of those people.
That
I
was
wasn't there. No.
I know a few of those people, but I can attest that I have an alibi. I was not in the building.
Yeah, that was me.
Y'all didn't make that party?
No,
No,
not at
I was
all.
too busy ordering my groceries on Amazon and cooking my own food. So no.
And not exposing myself to unnecessary people and things. Like that whole thing was just a big, especially since Tulsa's numbers are climbing. So yeah, no, that was unnecessary.
We'll see in what does it take? About 2 weeks, and then we'll see those
2 to
numbers.
3 weeks. Yeah.
2 weeks. We're gonna
Yeah.
see. We'll see
Yeah,
how that-
it's really amazing how it really actually happened the way that it was predicted would happen. We opened everything up on Memorial Day, and almost like clockwork, 2 weeks later, our numbers started going up again. And it's like, who could have predicted this? Oh, just every epidemiologist said this would happen. So sometimes in science, you want to be right, but you don't want to be right. And this is one of those cases where it's like, I kind of wished we were wrong. And then just like clockwork, almost to the hour, everything happened as we predicted.
Well, we got 2 minutes, 5 minutes, 4 minutes. If each of you would give a 1 minute straight to our community, what we need to do quickly. We'll start with you, Dr. Reed.
So continue to be safe, be mindful, just stay with the plan, of keeping yourself and your families home. Staying home is the best way to do it. And when you do have to venture out, just go with intention, go prepared, and go with knowing that you're going to a safe environment and not going to subject yourself. That's mine.
All right. Dr. Clark?
I liked what Dr. Reardon said earlier. Prioritize your health, prioritize the health of your family. Understand that this economy, those stores and, all those things that are out there, even if it's not the same store, that stuff is going to be there. We always talk about stuff and how your life is more important than stuff, because stuff is going to be there. Please prioritize your life. Stay home as much as possible. Use things that are available to you that allow you to stay home as much as possible. But if you have to go out, prioritize your health.
Thank you. 1 minute, Dr. Stevens.
I guess I'll just leave with what I'm always preaching to my social media followers. Live to fight another day. Follow the numbers. Find a trusted source for numbers, because sometimes media doesn't get it right, or the numbers that are posted aren't right. And so my numbers have been pretty spot on. I have a very good group of followers, and they ask questions, and they're not just here in Georgia, they're all over the nation. And they're always saying, so what about my county, or what about my state? Because I can get access to those numbers. So follow a trusted person for your numbers and live to fight another day.
Well, I want to thank you all for coming to Health IQ. It has been an insightful experience. I'll probably have to answer a phone call from Don tonight about all the mentions that we have, since we love him. And I'll probably call my friend Chris Como as well to see how he's doing, and tell him all about you guys and the beautiful scientists that came on Health IQ today. But I do want to say to all those out there that your life is in your hands more than you have ever had before. Your life is in your hands. You touch your face almost every X minutes without your knowledge. So your life is in your hands. Just know that your hands and your life are working together. I'm Munson Steve. This is Health IQ. Thank you all so much for tuning in, and we'll see you next week here on Health IQ. Peace.
Bye.
Bye.